it's a lifetime's job in my experience. But then also the other really strong message is, you know who you are and nobody else has the right to question you. Now, this is indoctrination from the early years onwards. So age 3, as soon as children start kindergarten, these books exist. So what you're doing is you're taking away from that child, or this generation of children, the stability of reality and the ability to differentiate between fantasy and reality at the most fundamental level of who they are. And the way, in this sense, that we're now the children and they're the adults is part of this message that parents are given. Your child is born whole with a fully formed sense of self. And so, my 4-year-old boy, she knows who she is. It's not up to us to question that, our child's wisdom. And, the child is dependent on us as parents. Our job, and we don't even see this as a job, it's just automatic. A child will say, look, Mummy, there's a dog. And we'll say, yes, it's a dog. And we can't, or that's a dog. No, darling, actually, it's a cat. We will constantly reinforce our growing child's sense of what's real and what's not. And we correct them if they make mistakes. And we don't see that as a job. It's just sort of automatically what we do with kids. But that's what we're doing. But in this case alone, we're saying, no, that's, you are literally a girl. And we're approaching it as adults who are thinking, I am affirming his gender identity. Not to the child, you're not. You're telling that boy he's literally a girl. So for him, he doesn't maybe understand biological sex yet, but for him, he's biologically female. On the child's level of understanding, a trusted adult is telling him he's a girl. So he's a girl.
Well, right, and providing a reason for his confusion.
Yes, and also...
that's the terrible thing.
Yeah, also the fact that he has faced disapproval, typically from the parents, from one or other or both parents, and perhaps from a wider circle, for the toy choices he's making and his friendships.
Yeah, right.
And so as soon as you say to him, he's a girl, and we get these sort of short-term honeymoon kind of results of, suddenly he's really happy. Well, of course he is, because now all his toy choices are approved of by the adults. And of course, what he wants to do is win the approval of his parents. That's what he needs to do for his survival. So you've got this terrible lie being told to children. And I think exactly the same with teenagers. Yes, they're developmentally later on, but it's exactly the same lie, and it addresses teenagers' specific vulnerabilities of identity formation.
We'll be right back in just a moment. First, we wanted to give you a sneak peek at Jordan's new documentary, Logos and Literacy.
I was very much struck by how the translation of the biblical writings jump-started the development of literacy across the entire world.
Illiteracy was the norm. The pastor's home was the first school, and every morning it would begin with singing.
The Christian faith is a singing religion. Probably 80% of scripture memorization today exists only because of what is sung.
This is amazing. Here we have a Gutenberg Bible printed on the press of Johann Gutenberg.
Science and religion are opposing forces in the world, but historically that has not been the case.
Now the book is available to everyone.
From Shakespeare to modern education and medicine and science to civilization itself.
It is the most influential book in all of history, and hopefully people can walk away with at least a sense of that.
So there's no difference between being self-conscious and being miserable, technically. But here's something else. Self-consciousness among females is much more associated with body dysmorphia. Now, there's a bunch of reasons for that. We don't know all of them, but here's a couple. First of all, at puberty, women start to experience more negative emotion on average than men. And that it's not true of boys and girls, but it does seem to kick in at puberty. And that's likely because you get size dimorphism developing. And so it's reasonable for women to be a little bit more timid about the physical environment than men. But also women are more sexually vulnerable. And also they have to care for infants. So being threat sensitive makes sense. Okay, and in any case, those are three possible reasons, but it definitely kicks in at puberty. Now, it also is the case that anxiety among women tends to take the form of bodily self-consciousness. And I think the reason for that, likely, this is a speculation, although the mere observation is a fact, it's likely because girls and women are judged more comprehensively on their physical appearance than men. So it makes sense that if they're going to be self-conscious, it's going to be more bodily focused. And then that's particularly rough. Then the third contributing factor is girls hit puberty earlier than boys. So now what, you have a perfect storm there. So now you have a girl and she's feeling a lot more anxious and confused than she did before because she hit puberty. Plus her body is doing 50 weird things. Plus she's getting all sorts of strange attention from adults that she never got before. Plus she doesn't know how to fit in on the social front. And she's trying to make that transition from childhood to adulthood. And then you have people additionally torturing about the fact that any deviation from the norm on the stereotypical front is actually an indication that she doesn't exist in the correct body. Well, she doesn't really feel like she's in the correct body to begin with. So it's a perfect storm for young girls. Now, when Canada came out with its compelled pronoun law 2016, I talked to the Canadian Senate. I said, you idiots in your legislation, you think you're going to free up kids. You're going to produce a psychogenic epidemic among young women because they're preferentially susceptible to psychogenic epidemics, which is why we had a bulimia epidemic and an anorexia epidemic, all of which was spread by social media, and a cutting epidemic. And then there's a history of such epidemics going back 300 years. I mean, Freudian hysteria, which was very widespread in the Victorian times, although disappeared afterwards or mutated, was also a psychogenic epidemic that preferentially affected young women. And so, well, I just wanted to lay out some of the reasons why that's the case. Higher levels of negative emotion and more bodily focused self-consciousness. And so then you add to that a kind of unpopularity because maybe a given girl isn't that sophisticated at manifesting, what would you call it, socially acceptable feminine traits. It takes a fair bit of sophistication to be a well put together woman, and you're going to be pretty damn awkward at that if you're kind of a clunky tomboy when you're 12. And so, well, now you're providing them with, first of all, a unidimensional reason why they're miserable is pretty damn convenient, and no wonder an adolescent wants that. It's like, do I have 50 problems? Or do I have one? Right, and then you also entice them with the additional social status that they're going to receive by now announcing that they're special and having every bloody teacher in the entire world, plus the world at large, focus on that narcissistic grandiosity that goes along with the insistence of a special identity. And the only price you have to pay is like enforced sterilization and surgical mutilation. Fine deal for our teenagers.
I think there are another couple of things about teenage girls that we don't pay as much attention to, but the very fact of physical development in teenage girls means your body is sort of ballooning, breasts here, hips here, bottom there. And you lose that sort of gender neutral body that gave you so much freedom in childhood. And so how girls experience puberty is moving from being a free kind of person into being an object, because suddenly her body is public property. And as you say, it's commented on. Everyone has a right to comment on it. She may, she'll get comments in the street. She'll look all around her and become aware of the objectification of women throughout society. Now, I think this is happening to boys much more over the past decade, in a kind of certainly objectification of the male body, and in some cases kind of sexual objectification of men. And this generation are used to seeing those really exaggerated images of femininity. So the female heroes have huge breasts and tiny waists and big hips.
Kim Kardashian.
And the male heroes, and you see are ripped with a six-pack, and they're hulks. So you get that in gaming, you get it in, it's sort of programs like Love Island, which I don't know whether you have in Canada. It's all about how you look. So it's happening more for men, and interestingly, boys' experiences of things like anorexia have increased, but not as much as girls. So girls are in a real, the gap is still widening.
Well, there's also the emphasis that pressure also comes on women younger. Not only do they hit puberty younger, but also, on average, cross-culturally, women prefer men who are 4 years older. And what that also means is that men prefer women who are 4 years younger. Although most of that's driven by female choice, by the way, but not all of it. But it also means that women come under sexual pressure in some sense earlier than boys do, partly because of earlier onset of puberty, but also because there's a tighter relationship between biological fecundity and youth in women than there is in men. And so that piles on the additional pressure for young women. So there's an overvaluation of female sexuality in some real sense that kicks in around the age of 13. And the advantage to that, I suppose, is all the attractiveness of youth and beauty. But the disadvantage is, well, there's a hell of a lot of competition and judgment that goes along with that particular contest. And certainly that does pile on a 12-year-old girl, with overwhelming force, especially when you also add to that the fact that women are much more vulnerable on the sexual front in some real sense, because they pay a much bigger price for sexual misbehavior, let's say, than men do, given the risk of pregnancy. That's a good definition of what is a woman, by the way. A woman is the human being that bears disproportionate responsibility for reproduction. It's a good biological definition, too. And you're stuck with that, right? You encounter that face first when you hit puberty as a woman.
And it's the constant, I think, dilemma for women, individual women, and for feminism, how to put those two things together. Because you're right, we have the biological responsibility that men don't have. And along with that, I think the disgust with the female body is pretty much tied into that, because it kind of makes you an animal. And you're reduced to your biology. And so girls at puberty, apart from not being developmentally ready to face all of this, sexual harassment. I mean, it's in schools now. There's an epidemic of sexual harassment in schools. And not that girls should ever be ready to face that, but they're so young, and they can develop breasts at primary school, age 11, and suddenly they are supposed to be a woman when they're still emotionally a child. And how hard that is. But also going back to the absolute female facts of menstruation, how disgusting is that? That's the real issue here of developing sexually as female. You bleed. I mean, it's disgusting. It is horrendous for girls, not all girls, but it's one of the things I think that happens at puberty.
At minimum, it's a challenge.
It's a challenge, and it can be really embarrassing and humiliating. It can create anxiety and worry. It can create, pain and feelings of real discomfort and all the associated physical effects that go with it, which boys don't experience. So boys will get taller and broader, and it's kind of everything that they were before just sort of gets bigger.
But more. Yeah,
but more.
Yeah, exactly.
Whereas with girls, completely changed. It's suddenly, I'm swelling out here and I'm swelling out here and my body's out of control. And if you've got an image of yourself as being intelligent, maybe even intellectual, bit different, all of those, it can be so humiliating to feel, actually, no, I'm just an animal. I'm just a piece of meat. My body will go on doing this and I have no control over that at all. That can be really frightening. And it can be, so all of this, what is awful now is that we don't look at girls, even though there's this massive, 75% teenage girls being referred to gender clinics, we don't look at them as teenage girls because, of course, that's transphobic. And this lack of differentiation between male and female means that they're all lumped together as trans kids, and all of the issues are seen as the same. And we know in medicine that the female body and women are not, looked at properly anyway, but this has really exacerbated that problem, that we're not looking at gender dysphoria in girls. Even to say they're girls is transphobic, but we're not looking at it within a framework of female adolescent health and all of the other issues.
That helps us move into a domain that maybe we can cover just as we bring this to a close. You've written a fair bit, too, about what I would characterize, I don't want to put words in your mouth, as the absolutely pathological stampede of idiot medical and psychological professional organizations to insist upon gender-affirming therapy. And so as a therapist, I'd like to point something out, which is the last thing I'm ever going to do for any of my clients when they come and see me is affirm their identity. That is not my job. My job is to listen to my client and help them understand their current identity and develop it in the direction that appears most appropriate as a consequence of the course of our discussions. So I presume people come to see me because they're miserable for one reason or another. I don't know why they're miserable. It might be terrible circumstances. It might be something they brought upon themselves. It might be some combination of both. But I certainly don't presume to know. And that's, in some real sense, a disturbance in identity. And then what the therapeutic realm is a place to explore the vagaries of identity. Now, I'm not there to affirm my client's identity, nor to deny it, right? I'm supposed to be there as a neutral, ignorant listener. It's like, you're complicated. I don't know who the hell you are, what's wrong with you. We're going to lay out a space of honest communication and try to develop a differentiated model of your identity and then try to optimize it. Now, then you get this insistence now that the professional colleges have brought in, which is no matter what your client tells you when you first encounter them, you have to agree with that, or you're unprofessional to the point where your license can be not only reasonably suspended, but should be ethically suspended. And I look at that and I think, oh, well, the whole therapeutic and most of the medical establishment is just done. If I have an anorexic girl come in to me and say, I had an anorexic client once, very thin girl, as you might expect. She wasn't very big. And I had her sit by me at one point. And I said, you look at your thighs and now you look at mine and you tell me which one's bigger. She said that hers was. And I said, okay, fair enough. So this is what we're going to do. I'm going to put a piece of paper under your thigh and I'm going to have you trace it. And then I'm going to put it under my thigh and I'm going to do the same thing. And I want you to watch so you see I'm not playing any tricks. Okay? So we did that. And of course, my thighs were about that much bigger on both sides than hers. And I swear she looked at that piece of paper for 20 minutes. Now, she trusted me by this point, eh? So she knew already that I wasn't playing tricks, but she still couldn't believe her eyes. And I think the reason for that is that I don't think that anorexic women can see their bodies properly. They lose the ability to see the gestalt, and they focus on a detail. And then they can't distinguish between what's fatty and what's bone, let's say. Literally, they can't see it. And so, but I wouldn't, if an anorexic girl came into my office and said, I feel that my thighs are too fat, I wouldn't say, well, if you feel that, you must be right, and it would be inappropriate and unethical of me to suggest otherwise. I would say, well, maybe you want to explore that, maybe you don't. I don't know if you have any doubts about it. I don't know if this concern is causing you trouble. I don't know if other people are reacting badly to your insistence that you're too fat still. Those are things we could discuss. I can't say, no, however you feel is right. And certainly on the sexual identity front or the gender identity front, exactly the same standards apply. So those are even more fundamental categories than thin or fat. So I just think it's the death of the therapeutic enterprise altogether. So, and unbelievable cowardice and lies on the part of the professional organizations.
And it's presented as conversion therapy to do anything other than affirm a child's self-diagnosis and self-prescription of treatment. And again, it ties into what's happening in parenting, whereas I think it's a good thing that we listen to children more now, because children weren't, when I was growing up, children really weren't listened to at all. And that's good. But listening to a child seems to be interpreted as agreeing with the child on everything. Mm-hmm. So, a therapist's job is to listen. There's a lot of listening in counselling or therapy, but it doesn't mean agreeing. And so we give up our knowledge, our perspective, our knowledge of facts in order to placate or appease or in somehow in a misguided way thinking that we're building the self-esteem of the other person. But we don't, that's never helpful. Certainly, long-term, that's not a helpful thing to do.
We could also point out, and should, that all therapy is conversion therapy. Right? The whole bloody point of the therapeutic process is transformation. Now, you could say, well, you shouldn't convert the client into a clone of the therapist's presuppositions, and that's definitely true. What you want to do, when I saw my clients, the first thing I would try to find out is, okay, why are you suffering? How and why are you suffering? And that's really complicated. That could take hundreds of hours to figure out, because maybe it's a psychological quirk, or maybe it's a catastrophe of situation, and God only knows how to differentiate those. So you have to listen a bunch. So the first is, well, how are you suffering and why? And then the next is, well, if you had your way and you could envision things being better, well, what would better mean for you? And how would you envision that practically? And so that's on the client, right? You don't want to interfere with that, because you can offer your opinion, you can say how you've seen other people solve that problem, but you don't want to muck about with that too much, because each person has to come up with a somewhat particularized solution to that problem. I don't know what your life would be like if you optimized it for you, in your particular situation. So we have to talk about that a lot. And then the third thing we do is talk about strategy, Now we kind of know what the problem is. We have some sense of what might hypothetically be a solution. We could delineate out potential strategies for achieving it. But all that's predicated on discussion. And none of that has anything to do with affirmation, except, I guess what you affirm as a therapist is you affirm the utility of honest communication, and you affirm the idea that through honest communication and inquiry, positive conversion is possible, right? Conversion towards some more ideal state of being. Very difficult thing to manage. But you certainly don't do that by privileging your client's feelings above all else, and then by being terrified into silence with regards to the responses you might have to an inquiry. So it's really something to behold, and you talk about the role of compassion in that, hypothetical compassion. One of the things I see continually, poor parents say, the claim is being made constantly that unless you give way to your child's desire to transition, they're going to commit suicide. And would you rather have a trans child or a dead child? That's a question that's often asked to parents. Okay, so I want to take that apart for a minute. Number one, even the bloody American Psychological Association, which has become a very pathological organization, admits in their documents of affirming care, and they do this by pointing to prejudice, there are no good long-term follow-up studies on the life course history of trans individuals. And then they say, well, that's because of prejudice against trans individuals. And be that as it may, I don't care about that at the moment. There are no long-term studies. So how the hell do you know that you're elevating or decreasing the suicide risk? And the answer is, you don't know, and that's a lie. And second, we know perfectly well that most people who manifest any form of psychopathology have a core set of symptoms. And those symptoms are basically elevated negative emotion, anxiety and pain. So anxiety and depression. You don't have a mental illness, except for maybe mania, where anxiety and pain aren't part of it. Okay, so then the question is, if there is a risk for suicide associated with gender dysphoria, is it specific to the gender dysphoria? Or is it merely a consequence of the fact that all forms of psychopathology are associated with anxiety and depression, and suicidality is associated with anxiety and depression? And the answer is, unless you have compelling evidence that it's specific to gender dysphoria, then the appropriate thing to do scientifically is to assume that it's a consequence of anxiety and depression and quit riding vulnerable parents with guilt. So for those of you who are watching and listening and struggling with these sorts of things, don't let idiot teachers and counselors tell you that by objecting to your child's gender dysphoria, you're elevating the risk of suicide, because that is a lie.
There is no evidence to support it, but the claim made is that your child is more likely to commit suicide if they are not affirmed and allowed to go on to puberty blockers. That's the claim. There's no evidence to support that at all. Parents can be supportive in lots of different ways, but parents are being bullied in the cruelest way imaginable to affirm their child and go onto this medical pathway through this, and the kind of the thing is now that not only parents, but all young people know that part of the persona, part of the rules of the tribe of being transgender are having suicidal ideation. That's part of what makes you true trans. So it's the most irresponsible. I cannot understand why the Samaritans hasn't spoken out about it, why, government ministers have not spoken out about it. We know about the contagious possibilities of suicide. We know the dangers of saying suicide is down to one factor. We know that, and yet we let this carry on in this area. And this is where, these are the kind people.
Yeah, well, this is, okay, so let's close up with this. So I've been thinking recently that our conceptualizations of narcissism are too one-sided. I think we concentrate on grandiose narcissism, sort of more masculine form of narcissism, more than we concentrate on the more feminine form of narcissism. And I think the feminine narcissism is something like narcissism of compassion. And that's associated with this idea, the Freudian idea of the Oedipal mother who, what would you say, fosters a sense of hyperdependence, the helicopter parent. Now, males can do that too, but it's more likely to occur on the female side because females are more agreeable and they are more compassionate. So the reason that I think part of the reason that no one is speaking out against that, well, you are, and I have, and there's a few people who are, but the reason that you get slaughtered so badly if you do is because the narcissists of compassion come after you and they say, well, it isn't like you care for children, you're just mean. We care for them so much that we'll listen to them no matter what we say. And then the underground message there isn't, we're doing best for children. The underground message is, look how much we care. Don't we deserve to have our social status elevated merely on that grounds? And maybe right to the highest possible point. We're so compassionate that we're Mother Mary herself, right? It's nothing but the Mother of God's voice talking here. And so anybody who is antithetical to that broad scale and all-encompassing compassion is instantly, deemed an agent of Satan for all intents and purposes. But it's so absolute. Like, I saw this woman. So she was a Disney executive, and she was testifying, if I remember correctly, when Florida was clamping down on Disney. And she said, she was the head of their domestic programming, something like that. She said, Well, I have a trans child and a pansexual child, and one's 5 and one's 7. And I thought, okay, let's just think about that statistically for like 1/10 of a second. The probability that you have a trans child is 1 in 3,000 before the gender dysphoria epidemic hit. 1 in 3,000. Okay, what's the chance that you have a pansexual child? Now, I have no idea what the hell pansexual means, but I know that whatever it is, it's rarer than transsexual. So at minimum, you have a 1 in 3,000 chance that you have a pansexual child. So what's the probability that you have a pansexual and a transsexual child? And the answer is 1 in 9 million. So here's the question. Are you a pathological narcissist of compassion? Well, what are the odds? 899,999. No, it's 8,999,999 to 1. That's the appropriate statistical analysis for that claim. So no, I don't think you have a trans child and a pansexual child. I think you are a devouring narcissist, and you are willing to sacrifice your own children to your narcissistic pretension to elevate yourself in the social hierarchy with no work merely by claiming that you're that loving. That's you. God, it's so awful. It's almost indescribable.
And I think that's partly that there is enormous pressures on mothers to be kind and nice and to be ever nurturing, ever compassionate, ever kind. And the other, that is the archetypal mother, the nurturer, the protector. But the other side of that is pushing away, rejecting. You can say it's the shadow side, but, as Jung said, if you don't integrate the shadow side, it'll come up and bite you. And actually, if you look at other mammals, they bite their young if they're trying to, get hold of the teat and drink milk with, and the mother's annoyed and irritated and pushes them away or even bites them. And we have to integrate that because it's and make allowances for that in ourselves, that part of our job is nurturing and holding close, but it's also pushing away or allowing the child to move away. And sometimes that needs a little push. And that is fine.
Right. The psychoanalyst said very wisely, I think this was Freud, but it might have been Jung. He said, the good mother necessarily fails. Right? So what you have, and this is very hard on women, and I understand this, I really do. I watched my wife go through it. My wife is actually quite a disagreeable woman, so she had less trouble with this than a more compassionate woman would have had. This is not a criticism of my wife, by the way. So when a child's an infant, so 0 to 6 months, you should be 100% compassionate because the child is immobile and completely helpless. And the rule there is whatever you feel is 100% correct. But then as the child starts to become mobile, maybe that kicks in, essentially around 9 months, the mother has to do this terribly difficult thing of starting to separate herself from the developing infant. And there's a real sacrifice in that. And there really is I would say the integration of the shadow side in that. Now, the proper way to handle that, the mature way to handle that is to think something like this, if you're female, to think, look, I did my time. I sacrificed myself for this infant. That was entirely appropriate. But I should have a life of my own. I should pursue my own things. I should pursue my relationship with my husband. I should pursue my activities in the broader world. I should facilitate my child's independence, and I should model for that child independence. And that means that the appropriate thing to do now is to move away from that extraordinarily bonded mother-infant scenario to something that's more detached and focused on autonomy and competence rather than all compassionate love. And that's, the Freudians and the Jungians were very, very good at delineating out the shadow side of the devouring mother. The best book on that, I think, is The Great Mother by Eric Neumann, which is an absolutely terrific book. Details out the symbolic representations of the devouring mother. And the devouring mother, interestingly, isn't the woman who pushes the baby away or the infant away, let's say, and says, go out and play. The devouring mother is the one that holds the child far too tightly in her loving embrace and will never let go. So Right, that's the shadow side of that hyper-compassion, and we're seeing that. You know, that we might be seeing that partly. I've never said this, I don't think, but it's only been 50 years since women have really been a force in the political world. And we could assume that there's going to be a feminine psychopathology that goes along with that, just like there's a masculine psychopathology on the male political side. And, you know, the male psychopathology might be narcissistic aggression, something like that. But the female psychopathology could easily be devouring compassion, easily. And I do think we're seeing that play out in our culture now. And God only knows what the consequence of that will be.
I think that's what we're seeing in the gender identity movement, that as women gain more power in academia, in politics, etc., you've got a combination of the sort of narcissistic entitled male, which comes from the generally middle-aged cross-dressers that you find in every organisation and company and political party, these, you know, powerful men. And on the other hand, you get this over-emotional, illogical, feeling-based kind of support and from the women, because this movement is supported so much by young women. And so you get the worst of the feminine, or the negative side of the feminine, and the negative side of the masculine coming together. Because I think
conspiring,
the marriage of the two. I kind of naively thought, wouldn't it be great if the world was run by equally men and women, because that would balance the yin and the yang. And I don't believe that a world run by women would be more superior than a world run by men, but together. But what if the negative side of men and the negative side of women come together? And I think that's what we're seeing. And on that note...
On that happy note, okay, so for everyone watching and listening, I'm going to talk to Stephanie for another half an hour on the Daily Wire Plus platform. We're going to talk a little bit about how her interest in parenting and then her interest in the broader social, what would you call, ramifications of attitudes towards parenting, how all of that developed. And I do that generally with my guests, something more biographical. Hello, everyone. I would encourage you to continue listening to my conversation with my guest on dailywireplus.com.